Hi, everyone. Welcome to Revive Health's Daily Briefing Live for Friday, April 17th. It's our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. Once again, I'm not Chris Bevelo. I'm Jeff Spear, subbing in for Chris, senior strategist here at Revive Health, and your guest host for the show today. As always, though, joined by the wonderful Chase Kleckner, Senior Marketing Manager, Revive Health, and our show producer, Chase. How you doing today?
Doing well. Glad to have you here, Jeff.
Thanks. Happy Friday.
Yeah, you as well.
And today we're joined by Jarrett Lewis. Hey, Jarrett, how are you?
Hey, Jeff, doing well. Thanks for having me.
Yeah, thanks for showing up. Jarrett's a partner at Public Opinion Strategies, a longtime partner of Revive Health. They're a national survey research firm based in Alexandria, Virginia. Jared's focused specifically in the healthcare industry, and prior to joining Public Opinion Strategies, he spent nearly a decade at the Health Management Academy, most recently running the health policy practice, and before that, running the firm's internal consumer research division. Jared's always great to talk to. We're excited to have him here today. He's got a lot of insights and opinions to share, data backed on everything. And as always, we'll talk about the healthcare industry and the implications there. But we wanted to take some of this opportunity also to get Jared to share things he's learning that are outside of the healthcare industry. Always important for us as marketers and communicators to consider the broader context of the world and what people are thinking and other industries are doing. So that's what we'll do today. Thanks again, Jared, for coming on.
Yeah, thanks for having me, Jeff. Thanks, Chase. Looking forward to the conversation.
Us too. So just a couple things we'll do here, but as with each show, we plan on covering the news and really diving in more on what Jared's here to share and some resources. But as we move through the show, please use the question queue in Zoom to line up your questions, and we'll get to as many of them as possible by the end of the show. You can also use the chat function to talk to other attendees if you'd like. But if you'd like to answer a question, probably Jarrett, less so than me, please use the question queue only. We've also provide some relevant links as we go through this. Chase will do that in the chat function. Finally, remember you can subscribe to the podcast on iTunes and search for Revive Health Daily Briefing Live. We'll post a recording of every episode each day. Yesterday, I believe our president, Joanne Thornton, was on. Really good talk there. And day before was editor from Health Leaders. So we're really bringing in a lot of different guests, including people like Jarrett. So please check the archives and subscribe. You can also visit our website, thinkrevivehealth.com/COVID-19 for Communication Hub, putting out different reports, including this weekend, a new consumer survey. So last thing, as always, we want to share a couple notes. We are not experts in COVID-19, so this is not a place to come for medical or scientific advice or resources. We do have opinions, and we're going to share them for marketers and communicators on how you might manage the crisis. But if nothing else, we know that every market's different, every situation's different, and in the end, you might have to make different decisions, but we're always here for you if you want to talk through things. Okay. We're going to begin. One thing we do every episode is we want to share the latest count of how COVID-19 is affecting us, the country, and sometimes the world. So we want to keep tabs on that, and we'll just go to that. We use the Johns Hopkins tool, which you can go to. Chase usually, I think, provides a link, so you can go there.
Yep.
But today, what we have is in the U.S., we have 672,303 confirmed cases. And unfortunately, that's 33,898 deaths. And there have been 3.4 million tests in the U.S. so far. It's stunning. It's stunning every time we hear it. And it's just important to put that in context. And I think really frames up today what Jared's going to talk about, which is how are people feeling about this? What are they saying? How is it changing how they're thinking or not thinking? But the scale of what we're dealing with here is pretty hard to fathom. So from there, I want to put on your calendar also this coming Tuesday, April 21st, we'll have a very special 1-hour episode of the Daily Briefing Live to provide a comprehensive look at what we're calling rapid recovery, the period coming out of COVID-19 crisis. And we definitely don't say that lightly. I think coming out of the crisis doesn't mean we're coming out of the impact of what we're dealing with, or the fact that we all know that there's going to be a resurgence of some type at some point. But for our clients, it's important to look forward and know that the impact of this on your communities and the people that have been delaying procedures, for example, or not being able to get care, and certainly the financial impact on your organization. Those are real things that are part of your responsibility and accountability that you've got to deal with. So the episode on Tuesday is going to be a special 1 hour. It's going to be Chris. Your normal host, will be back, and joined by ReviveHealth, our CEO, to talk about the rapid recovery plan and a deep dive there. So Chase will provide another link there, but please don't miss that. It'll be really good. Okay, Jarrett, we've gotten all the upfront out, and now we get into the fun things. So Jared and I have worked together several times, and I've had just really fun discussions with him on politics, the election, all kinds of things. So first, Jared, I would love for you to just give our listeners an understanding of the scope of the amount of research that your firm does, and kind of all the insights you're going to share today, where that's coming from.
Absolutely. And again, thanks for having me, Jeff. Chase, I really appreciate the opportunity and always enjoy working with everybody, the entire team at Revive. And I feel like over the last year, I've had a chance to work with almost the entire team at Revive. And so really enjoyed that opportunity. So we are, as you mentioned, we're a public opinion research firm. We're based in Alexandria, Virginia. Half of our firm's business is political campaigns. The other half is public affairs and corporate research for clients like Walmart and AT&T. We do a lot of foundation work, Bill and Melinda Gates Foundation, the Walton Family Foundation. And we have a pretty robust healthcare practice, as you all know. Do a lot of work for a lot of the trade groups that are based in DC, like the American Hospital Association, the AAMC, the AMA, those types of organizations. And then a lot of provider, state hospital association work, and then provider specific work as well. On a given year, we probably do over about 1,000 surveys, from surveys of 400 people in a congressional district to national surveys of 1,000 people. So we're constantly, we're in the field constantly, and that actually hasn't changed dramatically. It turns out that people are home more, so they're answering their phones. Most of our work is still phone-based. And so people are more likely to answer their phones right now. So it's been helpful for response rates. But we're actually asking about coronavirus in every single survey we do, whether it's a healthcare focused survey or a non-healthcare focused survey, because one of the things that we learned probably within 5 or 6 days of really the shutdowns and sort of the dramatic change that took place in early to mid-March was, if you don't ask people about this thing that has completely disrupted and changed our country and the world, they're offended. And so we had to start kind of weaving questions about coronavirus, because they wanted to talk about it. They wanted to get it off their chest. They still want to do that. And so even though we may be focused on an energy issue or, some other issue, we're still kind of weaving coronavirus. So we have a huge chunk of data on that. And then what I've been doing for the last month is, since all that's client work, compiling basically every single piece of national data, public opinion data point I can, and kind of doing a deck every 10 to 14 days, sort of kind of framing it in sort of buckets of from concern to sources of information to sort of lifestyle disruption to economic impact. And so probably looked at over 100 surveys, national surveys over the last 6 weeks, because there aren't many. Everything in the public domain now is all coronavirus.
Right.
And so there's a lot of public opinion data. And so trying to compile those and tell a narrative about sort of how Americans are feeling, how they're reacting, the potential long-term changes and impact this will have, obviously the impact on the healthcare system, short-term, medium-term, and long-term. And I know you guys are really focused on kind of, like you mentioned, coming out of the other side of this in terms of life going back to some sense of normalcy and sort of getting people back into with their providers and so on. So looking at a lot of different sources of information to sort of build this or come up with this narrative of where everybody is in the country.
I think that's amazing and really powerful for us. One thing we've all talked about is that this is so many different ways. This is a unprecedented time, but one of them is everybody's going to go through this. The levels at which they go through it locally, regionally are different, or just in different stages. So I think the data that you're about to share and talk to us about nationally will be really important for people to think about, even if that's not what's going on in their market. It may happen at some point, but it's a really good source of information, how we think about how people are thinking and behaving. So let's just get into it. Jared, I know you want to share some slides. So for our viewers, while Jared's doing that, you'll see that on the screen share. For listeners, we will make these slides available in our communications hub for the episode that you can go download a little bit later. And Jared will cover things that even if you're just listening, can't see the slides, it'll still be relevant. You can follow along.
Yeah. Can you see those, Jeff?
Yes.
Okay. I know we have kind of I know you have some questions, but I would just start with saying, just sort of to step back to the macro, the 50,000 foot level. And I know everybody, all of your clients and everyone that's listening and your colleagues and everyone's focused on really, so much of this is wrapped around the entire healthcare system. And that starts with healthcare providers and what you guys are doing in terms of best practices and communication and trying to get people comfortable going back in for necessary procedures, post, we're on the tail end of this, so much critical work. But sort of to step back from just how is this impacting the mindset of Americans in the country? And what I would say is, at least in my lifetime, and I think probably ever, there's nothing from a public opinion standpoint that there's no precedent for this. And the closest thing that, as I've talked with my partners, many of which have been doing this for 30 or 40 years, who founded our firm, they've said they've never seen anything like this. The closest thing is 9/11, but in terms of just the impact on and complete disruption on life and what this has done psychologically to people, and just, obviously the economic angst and the job loss, and just unprecedented in terms of sort of where we are. I mean, in terms of impacting every American, putting a hard stop on our country's economy, isolating people from their families and not being able to see friends and relatives and things like that. The uncertainty of the indefiniteness of this, of not knowing when we're going to get back to some sense of normalcy, and wondering, when there will be a new normal, but what that new normal will be. What will life look like on the other side of this, at least until there's a vaccine, but even, in perpetuity, because, pandemics have existed before and they will continue to exist after this. And so will this change life for the country and the world, and in what kind of way? And just sort of, I know we're going to get into some specific things, but one of the things that we do a ton of in our work, and I wish I could share that, but there's one of the things that we do a lot of in our work is open-ended questions, the verbatim responses, which are really rich in terms of how people are feeling. A lot of times that tells us more of a story than actually going through the questions. And so in almost all of our surveys, we have, verbatims. Monmouth University does a regular national polling series, and in the middle of March, they did it, and they actually released some verbatims that they had, and these are really, really interesting. And sort of just to sort of level set, but 35-year-old woman in California, let go. This was mid-March. Let go from my job, going to lose my health, my medical care. I have cancer, and I don't know how I will pay for my home. 37-year-old woman from Maryland, just being concerned and afraid all the time, unsure about what has happened, living in a world I don't recognize and did not know was possible. 30-year-old man in Indiana, have to shower at least 3 times a day being in law enforcement. As of last Friday, I'm a firefighter too. So just a sort of level set of where the country is in this very unprecedented time. I think people who work in the healthcare industry are incredibly locked into communicating with patients, communicating with internal, caregivers, providers, employees, figuring out sort of how to go forward from here. And so it's almost like a lot of people that work in the healthcare industry have gone into overdrive, but I think for sort of stepping back and looking at the impact on the country, sort of hopefully that's some good perspective of where people are, in the U.S. on this.
Certainly, the role of hospitals and health systems, particularly, has always been about community, serving people, serving individuals, and what is going to be there for them in their community in the next 6 months, 12 months. and longer, I think is going to change, and what people expect or need from them is going to
Yeah.
change, and everyone's got to think about that.
Yeah.
But yeah, let's get into some of the data, Jared.
Yeah. So, I mean, just a couple places to start. I know we talked about how are people reacting to the lockdown and social, or are people supportive? And one of the things that was really interesting early on is how quickly people adapted. Now, I know there were some governors that were slow to shut down. There still are some that haven't shut down, and there were some issues in, places in, Florida and beaches and everything. But as a country, I think people were incredibly quick to really, change their behavior in a way that I don't think. Well, there was a Bloomberg article I saw yesterday that basically the CDC's early modeling had 50% of people, estimated 50% of the country would adhere to social distancing guidelines. I think they've updated that. Now it's like 88 or 90% of people in the country have actually been adhering to the guidelines. And so I think even the CDC didn't see how quickly people would respond. Again, I know there are pockets of people that maybe haven't done as much or were a little bit slower, but I think just the sheer quickness at which people understood, hey, this is a problem and life's going to change. I'll show a really compelling slide here. Just over 1 week, if you look on the right side, how have you canceled or postponed any of the following because of the coronavirus?
Yeah.
This was 1 week. That's all it was. Going out to dinner, 9% the first week, the second week, 57%. And then again, this is in March, that 57% today is 95%, taking a vacation, 13% to 35%, attending a religious service. These are cancellations of these things, 3% to 33%. So I think just the sheer quickness and pace at which people actually sort of understood the gravity and followed, I think is something that's we saw in the first few weeks of this shifts in public opinion that were historical in terms of how quick opinions had shifted, in terms of how quick people went from thinking it was not that big of a deal to this is a huge deal. And that was before we hit those. Sorry, go ahead.
Well, I was going to say one thing that I can tell our group is two things, I think. First of all, shifting behavior, we always see is a really hard thing and is difficult. In this case, you're saying, well, look at how fast things changed. The second side of that, though, is it took a pandemic and it takes experts, local officials, federal officials, and peer pressure to make all of that happen. So everyone's thinking right now, okay, we got people to stay at home. That's great. Are they going to be scared to come back into a hospital or doctor's office? And will they just come once the restrictions are lifted? I think it's going to take a lot of marketing, communications, and leadership to do that, to flip the switch back, I guess.
I think you're right. I mean, I think one of the things that's really been interesting, Pew was out with a national survey yesterday where I think 66% of the country is worried that we're going to pull back too soon. I know that there's incredible economic angst, certainly income loss, job loss. There's just angst to get back and see family and get back people that have their kids at home. Like my wife and I have our 2-year-old, anxious to get, people back into school, not just so that, life can get some sense of normalcy, but also the education gap, right? We're missing 3 months, 4 months of a school year. That's pretty critical. So I think people are really ready, but right now there's still concern that we're going to do it too soon, that we are going to move too soon, too fast. And so I think you're right about the marketers and communicators and the chief marketers from health systems and hospitals really trying to communicate with those patients about it, coming back in, because you do need these to be treated. You do need these conditions managed and these procedures, because there's going to be there's going to be a wariness about snapping back in too soon, snapping back to sort of normalcy too soon. Yeah,
and we have to be viewed as responsible. Okay. Let's get into some other data.
I think one of the, I'm going to skip ahead here. I think one of the really interesting things, 2 points. You've seen kind of this, I heard this earlier today. Coach K, I think a week or two ago had, Coach K, I'm a Duke MBA alum. Coach K had Dr. Fauci on his weekly podcast, and Coach K called him America's point guard. And I think what's interesting about that is there's been sort of the rest of the team, so to speak, is sort of been disjointed, where at least in the eyes of the American public,
Mm-hmm.
the federal government has been, not great on this in the opinions of a lot of people, but state and local government have been sort of shining stars. I mean, you look at, DeWine in Ohio, Governor Newsom in California, Governor Hogan in Maryland, Governor Cuomo, obviously. You're seeing kind of this sort of state and local government impact where people are really are recognizing or sort of placing a lot of faith and trust and confidence in more localized governments, even though they're not necessarily sure the confidence on the federal government is not matching. Right. So there's been a really interesting sort of discrepancy there.
Yeah.
Obviously there's been, just a huge impact on economic confidence. We were, as a country, there was a lot of confidence the last couple of years in terms of the economy. And one of the things that was really interesting was how quickly people's confidence plummeted even before we really got into April, where we saw sort of, a drop in confidence. After 9/11, there was a drop in confidence that took 5 months. After the 2008 financial crash, there was a drop in confidence, 20-point drop in confidence economic that took 6 months. We had a 23-point drop in economic confidence that took 17 days. So I think the pace at which we sort of people have, just the magnitude of this, the impact of coronavirus outbreak on the economy, on wages, on job security, has been sort of obviously unprecedented. And there's just a huge pessimism about where things land and how long it'll take to get back. And I think that's why you've also seen incredible amount of support for the CARES Act and even more desire. I think one of the things that they did really well, Congress did really well versus 2008, was the huge chunk of money for small business, the $1,200 stimulus, the expanded unemployment benefits. Whereas I think 2008 was a little more focused on corporate and the banks. I think they did a better job, all parties and all chambers, of really making this more about the individual. And one of the things that's been interesting is when you go back and you look historically in 2008 and 2009, a majority of Americans throughout the entire 2008-2009 recession were worried that the government was going to spend too much money in terms of stimulus and to try to pump the economy up. We've got a situation now where a majority or a plurality of Americans are worried the government's going to spend too little. This coming after the $2 trillion bill. So people want to see around 4, around 5, around 6.
Well, I think that's really interesting, right? Because part of that's probably people understand the magnitude, and I think there's probably a greater group of people that are affected. But I want to ask a little bit about the CARES Act, because I think for our listeners that's valid, which is people support this. They think it's a really good thing. Of course it is. But we've talked on the show that the stimulus package for hospitals and health systems at this point is really insufficient. We won't go into the details of that, but how do you think our audience needs to think about it if the public generally thinks this is a really good thing and it's really helping? Is that going to be an issue if we're meanwhile needing to talk about the financial hardships that we're going through, if they think that we've gotten all this money?
No, the one area, and in fact, one of my partners does the CNBC All-American Economic Survey. It's a quarterly survey that he does with CNBC. And one of the questions was, in the most recent one, which was a couple of weeks ago, asked specifically about, of all the industries, who do you believe most needs, stimulus money? And by and large, it was hospitals and healthcare providers. I think right now, people, because of the increased opinions of docs, nurses, hospitals were already had a strong base of support, but they're through the stratosphere right now. I mean, there's never been a moment, I don't think, where physicians, hospitals, nurses, all, care providers, the folks on the front lines, have been viewed as positively and favorably as they are right now. And so I think for health systems and hospitals, I think, putting pressure on legislators, putting pressure on governors, putting pressure on the federal government to do more, because you're right, it wasn't enough, and they're going to need more. I would not want to be a politician on the opposite side of public opinion of providers right now. I just wouldn't. So I think really going and pushing that driving that narrative, which is people right now. I mean, it's the frontline healthcare workers and
I
the hospitals, and
I
so
totally
there's a
agree.
huge base of support.
And I think they've got to capture that. They have to. Our hospitals and health systems really need to take this moment in time and capture the momentum and the loyalty and the goodwill that they have for good, because mostly hospitals and health systems in normal times have a hard time activating people, getting them to pay attention to things in the community that are helpful for everybody, including the hospital and health system, let alone come to seek care at the right time.
Yeah.
In the right place. Talk a little, Jared. We don't have a lot of time here, but talk a little bit about the privacy side and some of the data you've seen and observations there, and how that might impact our clients right now who are probably thinking about opening up right now.
It's been really interesting because I think as a society, we have relinquished the idea of privacy in exchange for using Facebook and using Instagram and sort of the tailored digital ads and messaging that has come to us. But the one sort of last piece to fall on that has been medical privacy. And I've actually done some a good chunk of research on opinions around medical privacy. And I think, as recently as last fall, people were still felt very strongly about protecting that. This has changed, at least temporarily. I don't know if it's a forever thing or if it's a short-term thing, but this has changed opinions on medical privacy. People right now, because there's such a huge desire to get back to normalcy, people are willing to give up a lot of things when it comes to medical privacy. They're willing to give up, the contact tracing. They're willing to have body scans in terms of every building they go into. They're willing to share, who they've been in contact with. People are just willing right now to give that up because of how much everybody wants to get back to normalcy. And you sort of wonder, is it a short-term thing, or knowing that we're probably going to go through, like I said earlier, pandemics have existed before this and they will continue to exist after this. So do people sort of change their thinking a little bit on medical privacy to try to not have something like this ever happen again, where the entire world shuts down? So it's been really interesting to sort of see that flip in opinions. And there's Chase and a deck that I did recently. There's some really interesting data in there about how people are just willing to just sort of relinquish that information.
Well, and for the listeners, if Jared can stay on, we're gonna go a little longer. Jared, do you have maybe?
No, I'd love to.
So great, me too. Listeners, if you have to go, we'll come. Please download and hear the end of the podcast. But one of the things that makes me think about is our hospitals and health systems always need to think about the patient experience, the consumer experience, and the potential implication there is people are willing to give up something or do something more for what they perceive as safety. So we think about, hey, would you ask somebody to do this before they enter your building? Normally you would say no, but now would you ask somebody to stand 6 feet apart, give up their temperature, maybe not in a private setting? I think people probably be more willing to do it. And in fact, if you're not doing it, they might wonder why. So when we think about operations and going back to normal, we have to, I think, consider the mood and the mindset of people right now and what they're prioritizing, while still trying to find the balance of the things that we've always known are true on delivering great patient experience and protecting privacy. It's not normal times. So that made me, I want to talk a little bit about long-term implications for what you think, what you're seeing, and for our clients. And I'll drop one data from survey we're about to release on Saturday. And we are asking people, when will you feel comfortable going back to primary care doctor, hospital, facility? And the question is once restrictions are lifted.
Mm-hmm.
And only 30% of people said that they would do things as it relates to healthcare normally once restrictions are lifted. I want to plug a stat that you you shared in one of your surveys, I think a few weeks ago, that 12% of people said they would never shake hands again. So tell us, Jared, what are some of the other data you see, and what does this mean for us long term? We're trying to think about how are people going to be impacted by this?
Yeah, I think there's a couple things. The first thing is I would say people are really bad predictors. I mean, public opinion polling is really a snapshot in time, and people do a bad job of predicting future behavior. So I always would say, you caution in that data. That being said, we've never had anything like this before, and this has completely shut down the United States, basically. And so I do think that this will actually this will have a lasting impact for some people in perpetuity. For some people, it'll be a year. Some people it'll be 2 years. Some people it'll be 6 months. But in terms of things like, traveling, in terms of things like, going to restaurants that don't have tables 6 feet apart, in terms of things like going into sports is a huge part of the DNA of this country. Mm-hmm. And going to a stadium, going to an arena, going to a ballpark, I think a lot of people are like, when they open it up and it's okay, and the government allows these events to be held, I'm not sure I want to be there until I kind of wait and see how this plays out. Right. It's a vaccine that until people really feel comfortable, but I think you will see long-term behavioral changes. Even when there's a vaccine, I'd be willing to bet that a lot of people just change their behavior in general, because this, again, we've never seen some data that we're seeing before in terms of the impact this has had on people. And so I think this will stay with people for a long time. Other cases, people sort of revert back to the mean after 6 months, after a year, after 2 years, and different events that have, sort of been historic events. I think this one's a little bit different. I think, from the healthcare perspective, obviously, I know you guys have covered, you've done a great job in the surveys that you're putting out every couple of weeks. And I know you've been looking at telehealth and tracking the utilization. Yeah. And that's obviously going to be a long-term change. I think privacy could be a long-term change. I think mental health, certainly there is enough public opinion evidence to show that this has had, a long-term effect on a lot of people. And so that is going to have an impact, I think, on the industry. And then I think in terms of just, again, it will take some people time to get back into the ED or to doing electives or to go see their doctor. And so I think it's going to be kind of a, once the government lifts those restrictions, it's going to take time for, people, the full kind of market, for any health system to really be comfortable. And so I think it'll be about really figuring out what do they need? What would make them feel more comfortable, more confident in going back in? What can we do to try to get them back in a little bit quicker pace? And what information would they like from us to be able to do that? I think that's going to be critical. And, in terms of other long-term changes, I mean, I think what's really interesting to me is, we have one of the biggest challenges. I mean, I'm kind of very interested to see where Medicare for All lands on this, not to get political, but Medicare for All, one of the biggest problems with it has been the sort of the sheer size of, year over year spending or a 10-year window. And right now, between the Fed, between the CARES Act, between probably more stimulus coming, the federal government's spending money at a record breaking clip, and that people aren't blinking. In fact, they're worried that we're not spending enough. And so you sort of wonder, what does that do for the whole debate around Medicare for All? Now, the flip side of that is Medicare for All likely brings rate cuts to providers potentially. And I don't think anyone right now would ever suggest that hospitals, docs, nurses should see any sort of cut. In fact, it should be the opposite. So there's a lot, I think, that remains to be seen, and opinions are going to continue to evolve on everything around this, and how this ultimately impacts the country and society.
Yeah, and I think we can wrap in just a minute, but I don't want to leave just yet, because Jared, you just talked about how these opinions have changed in basically 5 to 7 weeks, massively, and some of them in the span of a week, behaviors and opinions. And now we're in April. We've got an election in November. Between now and then, the things that are going to happen to the country because of COVID-19, and who else knows what might happen, and the ups and downs we'll likely go through, as well as the politicizing of it, I think absolutely will affect our clients and how people are viewing hospitals and health systems, their role, and what messages and things they need to hear to feel safe or to be loyal. if we think about a state like New York that's been impacted maybe more than anybody, but is also a democratic state, that's probably a different mindset in people compared to, say, a southern state that has been impacted and now needs the government. So I guess this is a way to ask you, how important do you think it is for our clients to think about the national picture, but the local effect could be different depending on the governor, depending on the impact of COVID, depending on the economy?
Yeah, I mean, I think it's a great question. First, I mean, it's unfortunate that something like this is politicized, but I guess that's the world we live in these days. But I think there will be different. It will certainly differ state by state, because there will be some states that won't see the severity that some other states have seen. But then again, you look around and you see some states, maybe southern red states, that are probably gonna, get hit a little bit harder, or at least in the coming weeks. Hopefully not, but it's, just sort of where projections are leading. But then you have a state like Louisiana that's been probably the second most impacted state, or maybe third most after New York, New Jersey. And, Democratic governor, but it's a red state. And I think people there are acutely aware. I mean, I think it was the CEO at Auctioner was part of the press conference in the Rose Garden 2 days ago, Warner Thomas, as part of their rapid response efforts in conjunction with the federal government. So I think it's, from a health system standpoint, again, I think people are what this has done, sort of, I mean, people have always had tremendous respect for physicians, for nurses, for hospitals, and sort of that trust. But I think it's at a level it's never been before. And so I think sort of the health system sort of being, I think the opinions of hospitals and health systems change out of this, and I think change for the better. As recently as 6 months ago, you're seeing, I have a set of 3 slides that have have headlines from the New York Times, from NPR, from Wall Street Journal, about all, how bad hospitals are with surprise medical billing, and hospitals charging, and hospital consolidation, and all this narrative about how bad hospitals are, which is, I don't agree with, but there was sort of this growing pervasive narrative, and that's all stopped. And I think people are sort of understanding, hey, this could happen again. And that's the backbone of protecting our community, protecting our state. It's that institution, it's those workers. And so I think that's where health systems and hospitals and docs and nurses are really kind of apolitical. They're sort of viewed completely separate from everything else. I think when it comes to government, there's sort of this security that I think communities have.
Well, it should be. It isn't always, as you pointed out. And I think for 5-7 years, the narrative was really going against us. So I think we'll end there and say to our listeners that is your opportunity. That is your challenge. That is what, amongst the many things you need to think about, is what is your plan to hold on to this moment and use it for good, for your community, for your organization, for the people that are putting their lives on the line, so that in 6 months, 8 months, 10 months, we're not back to normal for how hospitals and health systems aren't viewed for the public service they're doing, and instead getting headlines about surprise bills only, which I could go into forever about why that's not our fault, but we won't today. But Jarrett, thank you so much. It's been really great talking to you. I could probably do this for another hour.
Absolutely. I really appreciate the opportunity. And again, I know the work you guys are doing is so critical in helping health systems and the health systems, the marketers, the communicators, because that's the thing right now, is there's nobody that's trusted more than the hospitals and the docs in the country. It's not even the federal government, or not even the CDC or Dr. Fauci or governors. It's really the providers that are the most trusted. And so I know, helping and working with folks to really, channel the communications, I think is so critical. And so thank you guys for what you're doing.
Thank you for always keeping us smart. So that's it for today's show. Please let us know if there's something you'd like to cover tomorrow by posting in the chat tool. Thank you, Jared, for joining us again. Everyone, please check out the slides that we'll be posting at thinkrevivehealth.com/COVID-19. And if you'd like to talk with Jared more, just let us know. We'll help you reach him. His firm does really great work and can really help you and your institutions understand what's happening in your market very intimately. And then please don't forget, on Tuesday, April 21st, from noon to 1 p.m., we'll have a very special episode with Brandon and Chris Bevlow, calling Rapid Recovery. Finally, to all of you out there, hang in there, keep up the amazing work. The skills you bring as marketers and communicators are more important than ever. They're always important, but finally, maybe you're also getting some recognition in your organization for the important work you're doing as we move through this crisis. We'll be back on Monday and every weekday until this passes. Talk to you then.